questions. A lot of discussion and debate about the accepted line of treatment for the new variant. We've gone through CT scans, plasma, remdesivir, steroids. Has the time come for a pan-India accepted line of treatment for corona? Do we have one globally? I mean, is there a consistency that is missing? What do you recommend? What is that consistent line of treatment at the moment? Can there be one for COVID?
No, there is a pretty consistent line of treatment. Doctors who know about COVID and who are actively treating COVID are using steroids only on the 4th, 5th or later than that if the patient needs it. Remdesivir has specific indications. Plasma by and large has not found favor unless you want to give it within the first 5 days when the patient has formed no antibodies, but the results are still equivocal. The use of doxycycline, ivermectin, AZI, which are all for 4 or 5 days, is also quite consistently accepted. Anticoagulants or blood thinners are also used, as is inhaled cortisone. The question is, unfortunately, the WhatsApp University, when you're telling a patient you don't need steroids, he says, no, I've taken it because my uncle was given and my aunt were given and they are better, so they take steroids. And 10 days later, they again call you and say, will I now get the black fungus because I took the steroids unknowingly? So unfortunately, poor data being thrown up and churned up by all these WhatsApp messages about black fungus, about use of, first it was use steroid, then now it is don't use steroid. So when you give a deserving patient steroid, he questions you 5 times. And after that, he comes back with black fungus. If you didn't give him in the erstwhile time, they would say, why aren't you giving it? So I think the policy is patient dependent. Each physician, every center knows how to treat. There is no fixed zip line of treatment which you follow mathematically. It is to be decided at the bedside on a case-to-case basis.
You mentioned black fungus 3 times and we've got a lot of questions on it. Let's get it very clear, Dr. Thacker. Can use of steroids lead to black fungus? How common is black fungus among COVID patients? Should we be, is there a real cause of concern that steroids are leading to black fungus? And what is black fungus?
So black fungus is a growth of fungal material caused by a bug called mucormycosis. But it is so rare that it is the indiscriminate, untimely, excessive use in patients with poorly controlled sugars that causes it. So when doctors with good knowledge use steroids, they give it for a short period of time and they wean and taper them off. Because steroids have a good feeling effect or a feel-good factor, patients often continue them. The black fungus will breed in poorly diabetic controlled patients, patients with elevated sugars for long. It's like keeping bread outside. 1, 2, 3, 4th day, you'll see a line of fungus. So anything that is not properly looked after, whether it is sugar, whether it is excessive use of steroids, whether it is unnecessary over antibiotic use, you're going to get fungus. We've seen patients who take doxycycline from their father and azithromycin from their mother and take both the things. So when they consult us on the 3rd day, they've taken 1 tablet each from the relatives. So they are on 5 tablets because everybody says, you take this. And these are the peoples who saw the branch on which they sit and the branch falls off. If you are enlightened, if you go to the right place, you will have no problem.
Very quickly, doctor, therefore, Dr. Thacker, the treatment for black fungus and the symptoms that I should worry about?
So if you have been in hospital for more than 2-3 weeks on a lot of high antibiotics, on steroids, and if you are diabetic, and if you've used oxygen for long periods of time, maybe the oxygen has not been hygienically delivered to you. If you start getting unnatural headaches or unexplained sinus pains, forehead pains, visual disturbances, that's when you should start going to the doctor and thinking and asking him whether you have something growing in the sinus, in the orbital area. But that doesn't mean that every headache after COVID is a fungus or a black fungus. It's pretty rare. We are seeing them in single-digit percentages, and that too under 5. So one swallow does not make a summer. If you've been to the right place, followed the right orders, your symptoms of headache, unless the visual symptoms, unless you have persistence of fever and feeling of infection with abnormal blood parameters, you should not run away with this. You know, quite often the fungus is in the mind and not in the body. So that's my saying. Having said that, an index of suspicion on the part of the doctor is very important.